Hey, it's Chris Byer.
Chris Bowling,
What's up, CB?
how are you, my man? It's Friday.
Oh, it is Friday.
Week is almost over.
It is. I'm coming to you on the road, so hopefully all my technology works this morning. I apologize for any bad video, bad sound. We'll just go with it.
Hey, that's the beauty of the virtual environment.
Yes, yes, absolutely. So I know, Chris, we just finished up a series on the challenges facing the C-suite. A lot of it was focused on current market conditions, both through the economy and for healthcare for the CEO, HR director, and the CFO. But we wanted to talk this week and then next about the journey for an employee and their family and what that means for them to be engaged with healthcare, because we do talk a lot to that executive role. So as we're thinking about the employee, why is it important for us to acknowledge that there's a journey an employee has to go through with their family when they use healthcare? I mean, that we are in that spot. We are employees with families, and we use healthcare. So,
well, and it was funny because we talked about the C-suite.
Yes.
Guess what? You don't have to talk to the C-suite if you don't have employees and if you don't care about health insurance.
Yeah.
Your employees. So yeah. Truly everything we do, everything we talk about is all about the employee, right? I mean, yes, we can talk about budget, we can talk about HR, but none of that is relevant if we don't have employees and if we're not trying to provide healthcare to the employee. But the journey of healthcare has gotten horribly complicated.
It has. It has.
My hope through COVID is we would find some advancements in technology, we would find advancements or just the ease of accessing a primary care physician. I think we saw that, right? I mean, we went from teledoc or something like that to now truly having a virtual office visit with your primary care physician. So we saw some enhancements, but yes, the healthcare journey, is once again something that I think everyone has to continuously educate the employee on.
Yeah. When I think about it, you and I both have had a year of health concerns, nothing super major, but we've had our stuff. We've been in for various reasons. And you and I both get done with that. I'm like, man, that was not simple. That was complex. And we know what's going on.
Right.
But, it's just that, if an employee can be provided with some form of engagement tool that helps them navigate, or they have that concierge service that they can use to set appointments and go through, that's one component. But I think even stepping back from that, when we work with self-funded employers and we are talking to employees about using their healthcare, and one of the first things that we share is that employee, if you're sitting here today and your family's on the health plan, if we are a self-funded employer, it is not the ID card's logo that says XYZ carrier that it's their money. It's not their money. It's not the carrier's money. It is your employer's money. It is your money through payroll deduction that go into this pool of dollars that helps pay the medical claims for you, your fellow employees, and the families. And I will say, when we've taken on a new client that we've never worked with or that has just moved to self-funded, so many people think that whatever logo is on that ID card is whose money is being spent. And that is a radical shift in mindset, because yes, we want to make healthcare simpler, but it's also, now we know that when I go to the doctor and I make that decision, am I getting the most for the dollars that we're spending collectively? And am I spending them well? Because we do want employees to use healthcare, but we want them to use it to where it's done efficiently and they get the best result.
Yeah, and most employees don't understand how a employee contribution is calculated, right? I mean, you and I say over and over and over, you can't hide from your claims, right? And when you are a self-funded client, just to help educate the employee, 20% of the cost is fixed cost, right? It is the cost to get you an ID card. It's the cost to
process the claim,
customer service, process your claim, but 80% of the cost of health insurance under a self-funded employer are your claims.
Yep.
So, if you're not a good consumer or you're struggling with how do I navigate healthcare the best, I don't want to say poor decision, but every decision you make impacts what you'll pay next year and the year after that and the year after that.
And that's a foundational piece of an employer considering to be self-funded, or when they start working with us, trying to get costs in line so that they don't have to continually increase the employee's cost share or their premiums or raise their out of pocket is think about how you're spending those dollars, because every dollar you spend is partially yours and partially your fellow employees and partially the employers. And the better that's spent, the more money remains. And that means we don't have to see as many increases over time.
Right. I've always said one of the worst things our industry created was a copay.
Yes.
Because the copay took the knowledge away from us of what is this costing, right?
Yeah.
I
I can go here and it's 30, or I can go here and it's 30.
Right. And the pharmacy is where we are the most blind of, we're just ignorant of what is this costing, because we pay our $50. And, you know, maybe I haven't said this on our LinkedIn, but I was the perfect example. You know, I was on a prescription. I paid $50. I had no clue what this thing cost until I went to an HSA.
Yes.
I rolled through and they said that'll be $650. I'm like, what?
Oh, it used to be 50.
I'm like, oh, heck no. I'm calling my doctor right now, or his nurse, and figuring out what is this drug and is there something else I can take? Sure enough, Chris, I went from a $650 drug to two $4 generics, and it was the same thing. And you know, like I said, copays made us really blind to cost. All we focused on was, well, hey, it's only $30 or it's $50 or it's $100, you know, or it's $10, whatever it is. But we are horrible consumers of healthcare because we don't understand what things cost.
Yes, absolutely. And I think that's the concern, is that an employer puts in an HSA compatible plan, and now employees do find 650, and they don't know to make that call to their doctor and say, doc, what else can I do? And so they don't go with that drug and they have something happen. I think that's the other thing is, as you are a consumer of healthcare, yes, it's one thing to understand your benefit program, and we can do our best to help educate that, but it's also important, like you said at the beginning, to have that relationship with your doctor, and you ask questions. Ask your doctor, why are we doing this? What's this going to do for me? Is there some other alternative? Because at the end of the day, it's going to be your responsibility to pay that bill, and it's partially your employer's responsibility to pay that bill. And if it's something that isn't getting you the right outcome, or it's not going to make you healthier, why are we doing it? But we're so quick to just say, yep, do it because it was recommended and I've got my copay. So, you know, as we kind of summarize this first part of the employee journey, it's everybody's in on it. You know, we're helping educate, we're coming up with ways to make healthcare simpler, but it's a pool of money that you and your employer collectively spend, and we want it to be spent well so that over time, maybe we get control over this.
Yeah. And my final comment to this part is, you can throw all the technology in the world at your employee, apps and concierge service and everything else. But if you don't take the time every month and educate on something, you're throwing money right down the drain. Because you know, how many different apps, Chris, have we had?
Oh, all of them.
All of them.
We've had them all. Individually, we've had them all. Yes.
And if you don't have the basics, just the basic understanding of, why do I even have this app? Because out of sight, out of mind.
Yes.
My best comment is, when's the last time you looked at your phone and you made sure every app on your phone you use every month?
No, I just keep sliding those over because I don't use them.
I need to move those to the end.
Yes.
Guess what, Mr. and Mrs. Employer, you're spending X amount of dollars per member per month, or you know, whatever that financial arrangement is for that app. If you're not constantly educating of the benefits of this new technology or whatever your new thing is to help an employee, you're wasting money. You've got to educate on it every month. And if it's, you know, if that app has 10 different things, that's 10 different things you have to educate on, not just here's the app. But no, it's had them all.
We've had them all. We've had them all. Oh man. But yes, I think in our next topic, we're going to walk through some of the things that employees and their families should consider when they're accessing care. So
perfect. Look forward to it.